Thank you, Speaker. My question is for the Premier this morning. Premier, one of the most frequent issues that comes up in my constituency office in Belleville is home care, or the lack of it. Patients and their families are often on the receiving end of much less care than what the CCAC has originally promised them. Last week, we learned from the Auditor General why, and the minister is probably going to pop up here like a whack-a-mole and tell us that he's spending millions of dollars more on home care, but what the Auditor General told us yesterday or last week is that more and more money is being sunk into administration and sunshine list salaries, and less is going into actual health care on the front lines. So, Premier, can you explain why only 47% of people who need to see a nurse in the first 24 hours after leaving hospital are actually seeing one of the home care workers, and why administrative salaries have gone up by 27%? Good question.
Thank you, Mr. Speaker. I appreciate the question, and it is unacceptable, that figure that he just described about the rapid response nurses, that it's so important when individuals do transition out of hospital that they can expect to receive that care when they arrive home to support them. So we will be working with our LINs and our CCACs to make sure that we can improve that, to set targets and to measure the success, so we actually see that improvement in that area. I've said last week as well with the Auditor General that we accept all of her recommendations. They're important, equally important. She also has an important recommendation number 5, which says essentially that we should review the entire model of delivery of home care to Ontario citizens. We plan on not having another review, Mr. Speaker. We've been spending a long time looking at this. We have Gail Donner's report from earlier this year to benefit from. We're taking the whole set of recommendations and moving forward to make sure that we're providing the best possible care we can for these vulnerable individuals.
Yep.
Thank you. Supplementary. Speaker, with all due respect, and back to the Premier, you've had 12 years to figure this out. You're dumping millions of dollars into the salaries of people who don't see patients. Katie Hollister-Loeb in my riding is one such case. She was originally told that 90 hours of care per month would be provided to her mother, who has end-stage dementia. That was reduced first to 80 hours per month and is now being reduced all the way from 90 down to 40 hours a month. Katie and her husband had managed to cobble together some additional care through community care programs that they pay for, but that barely covers the hours that the CCAC originally promised her mother. They may have to leave their jobs. They may have to move, Mr. Speaker. Speaker, can the minister explain why Katie's mother, who spent 42 years as a nurse, deserved to have her care cut so that more money can be put into administration, into bank accounts of those working in administration, executives at CCACs?
Thank you, Mr. Speaker. And I think most of us know that the CCACs were actually a creation of the Conservative Party in the late 1990s. And, Mr. Speaker, we actually saved a significant amount of money when we took the PC's 43 CCACs that they created around the province and reduced them to 14 so that they were coordinated well with the LINs as well.
The member from Renfrew, Nipissing, Pembroke, Warren. Finish.
So after the Progressive Conservative Party created those 43 CCACs in the 1990s, this is, in fact, these two reports this year are really the only substantive reports that have been done by anyone of our CCACs in that 20-year period. I welcome the recommendations. We plan on implementing all of them, Mr. Speaker.
Thank you.